So get ready. Yes. So, yes, you can write real participation, or you can say A. Those who are available, you can say A. Live participation. That means you'll come on audio and video. Or B. Written participation. Written. So only writing. So only you will be typing. Whatever you will be typing. So those who want to participate live, okay, can type your name. Okay. So good evening, Srija. So Srija, are you A, live? Muthulakshmi is live. Very good. Congratulations. Yeah. You can unmute whenever I tell your name and you can start your video. Yes. So you'll be given first preference. Number one. First, every question you will get the first chance to speak, Muthulakshmi. So you can start your video. Yeah. So this is the order which I call. Number one, same order. Yeah. A, because only those people who say, them I'll give the mic and the video. Number one, Muthulakshmi. First, whenever there is a question, first Muthulakshmi will answer. Yeah. So all of you, you write down whether it is just a live A or B written, which participation you want. Okay. Type of participation. So you want live participation or B written participation. Srija says written live. Okay. Srija. Number two. Number two. Next is Srija. Srija Ravindran. So immediately after Muttu, you will be given the mic. Be ready. This is the order. This is the order. So Srija Ravindran, you can open your video. Yes. Srija Ravindran. Yeah, very good. Okay. Mine is already here. Only those two faces will be there here. So pin is already there. My pin is already there. Okay. My pin is already here. I'm pinning. That will be permanently there, my photo. So, right. So there are two participants. So what you do is turn your phone like this one, auto rotate, full screen. Yes, that's it. Learn, because you will be regular participants every time. Yeah. If anybody is interested, give your names. Hifza, B. Okay, fine. No doubt. You can write whatever you want. You can write. When others are participating, you can write. Yes. So today we have two participants. One is Hifza, A. Very good. So Hifza, your point is third point. Hifza Jailani. You will be given mic. You will be given video. So Hifza Jailani, you can open your video. This is a very special session. Once again, I'm telling you. Those who don't want to participate with voice and video, Please type your sentences. Okay. Live. Right. Yeah. So we have two videos on. One is Muthulakshmi, one is Rija Ravindran. So Hifza, you can start your video. Once you start your video, then only you will get this. Okay. Right. Now here is the topic. Remember this very carefully. Yeah. Yes. Right. Now the point is, this is the card. This is the card. All of you can prepare this card. This is the card. Yeah. This is the card. Prepare the card. You have 3 minutes to prepare for the card. Or take 5 minutes, no problem. Make some notes, whatever, because I'll be talking. So first speaking will be for Muthulakshmi. Okay. Second speaking will be for Srija Ravindran, because these two candidates have opened their videos. And you will get your typed version, because pilot has come already. Artificial intelligence. Yes. Right. So 2 candidates are on roll. So if nobody is there, then I'll give you another card. Okay. So the participants who are participating will get as many sessions as possible. For those who are not on the video, you will have only on audio calls. Yeah, because we are on a special mission. Right. We have to change, adapt. Okay. Some new techniques. Yes. So Muthu Lakshmi. Others, whatever questions I am asking,
Yes, sir.
only Muthu Lakshmi will open the video. Yes. Yeah. Very good. Thank you, Muthu Lakshmi. You understood my signal. Very good. Yeah. Are you ready, Muthu Lakshmi, for the speaking session?
Yes, sir.
All the other students. Okay. So the mics will be mute. Only Muthu Lakshmi's mic will be unmute. Yes, unmute Muthu Lakshmi. Yes.
Yes, sir.
Right. So once you are ready, you can start.
Yes, sir. Let me start, sir. Card.
Yes. The name of the candidate is Muthu Lakshmi. She is from Tamil Nadu. She is a nurse and she is preparing for a nursing specific OET. And the role play card is Whiplash. The problem, the case is Whiplash. Yes, once you are ready, you can start.
Yes, sir. Let me start.
Yes.
So, can you display the card, sir? Good evening.
Good evening, nurse.
How are you feeling now?
Nurse, actually, I'm very much confused. Why have I been kept in the hospital for so long? There are no signs of broken bones, cuts, or bruises. Then what is the reason why I am here?
Yes. I understand your concern towards your hospitalization, but before proceeding further, I'd like to introduce myself. I'm Lakshmi, one of the registered nurses working in this hospital ward, and I'm your attending nurse today. So, have been admitted here for the whiplash injury the past previous day. So, in a car accident, is that right?
Yeah, of course, nurse, you're absolutely right.
Yes. Could you please tell me your name for the confirmation?
Yeah, my name is Abraham Lincoln and I am 35 years old. Yeah, as you know, I was involved in a car accident earlier today and I am suffering from whiplash and a headache. And I'm feeling very sad why I am here. And I want to be better soon.
Yes, I totally understand your emotions towards your hospitalization, and the reason behind of your hospitality is to observe your condition and observe your current condition, because due to an injury you may get an effect of accidental shock, so that it, it is really required to observe your health for for some time. So once the satisfactory assessment has been done by the doctor, he may proceed to discharge process. How does that sound?
Yes, of course, nurse. I absolutely understand what you're saying, but okay, that's okay, understood. But why am I being given this medication? What's the
Yes,
problem?
yes, I truly understand this respective question, but the pain may induce a headache, and you may feel any further uncomfortable pain and discomfort with your current health. So we are giving this medication based on our doctor's prescription. And once you reach home, it would be better to apply the heat packs or ice packs on your head and analgesics for the painkiller. And you can apply that heat ice packs in a collar. Is that able to understand?
Yes, of course, nurse. And then, to speak frankly, nurse, I want to get better in the shortest time possible. So I would be thankful to you if you can tell me if any physiotherapy will shorten the recovery period for me so that I can get better sooner.
Yes, your question is valid, and I really appreciate your concern towards your health, and you're taking really the active participation towards your health. So that I would like to recommend physiotherapist for the further exercises and strengthening and stretching of your muscles, and also the relaxation exercise to loosen up your joints, because after the accident you might have contracted with the muscles, so it may produce some kind of pain. So it would be really recommended, and I suggested you to visit the physiotherapist. And if you would like to proceed, I'll make an arrangement for the physiotherapist for the further recovery process. But I'd like to say you, I'm not the authorized person to reveal the recovery process, and apologies for that. Is it okay for you, Mr. Linda?
Yeah, of course, nurse. And I want to ask you one more question. I want to know about the length of the treatment. I mean, how long will it be before I am better?
Yes, it sounds perfect, but the recovery process and the continuity of treatment will depends upon your physical condition and your physical fitness. If the health is easily cooperating with the medicine and the exercises, definitely you'll get recovery and this medication can be stopped. And if the pain is not persistent and if the pain has reduced, the painkillers will be discontinued according to the doctor's suggestion. Do you like do you like to continue?
Yeah, of course, nurse. Whatever you say, I'll follow that one. But is there anything else that I need to know? I want more
Yes,
information regarding this, please.
yes, Mr. Lingan, your concerns are really valid. I also want to inform you, if you have any pain, any intolerable pain or unbearable pain, definitely you can reach us and we'll give the consultation so that you can get reduced from the pain and you may, if you feel any vomiting, nausea or any discomfort or any vision problem, because these are all the contributing factors followed by the accidental injury. So that I am recommending you to and I'm warning you to, along with these symptoms, if these symptoms are persisted and if you face any kind of symptoms, as I mentioned earlier, you could have reached us and we will definitely support you to get your health back as normal. Would you like to try that, Mr. Lingan?
Yes, of course, nurse. And one last thing.
Yes.
Are there any chances, for example, I want to ask you if there could be any after effects or ongoing problems or any side effects, by the way, as a result of my accident?
Sir, I didn't get to. Can you repeat, Mr.?
Are there any, will there be any after effects or ongoing problems as a result of my accident that I am going to face in the future?
Yes, your concerns are valid, and I also appreciate your responsibility towards your alarming signs, which is the pain is for unbearable pain or any discomfort, nausea, vomiting, or any vision problems. If you have any blurred vision or feel nauseated, these symptoms are the indicating symptoms of further complications. So we can alarm, we can we can alert by ourselves with these symptoms so that you can reach us and will definitely provide the complete and appropriate management for your side effects if it is so. Would you like to try that?
Okay, nurse. Thank you very much.
Yes, it's Mr. Lingan. And also I'll provide you the pamphlet. It contains a lot of information regarding how to manage the side effects and the symptoms of potential complications of a head injury, so that you can go through it once you reach home. And once the doctor decides you to go home, we will make an arrangement for the discharge procedure. Is it okay for you, Mr. Lingan?
Yeah, of course, nurse. Definitely, that's fine. Thank you very much once again.
Thank you, Mr. Lingan. Please take care of your health. I'm leaving now.
Yeah. So,
Thank you.
thank you. I'm pleased with your suggestions. Yeah. So, now coming to the point, Muthulakshmi, here we have for us, there are two different things. First thing is the pauses and breaks that you're taking. There were too many in the beginning stage, but afterwards you have recovered, but still there are a number of pauses and breaks to you that you have to control. And then the second one, you have said the reason behind of your hospitalization, the reason behind of your hospitalization. I don't understand why this off came here. The reason behind your hospitalization is the reason behind your hospitalization. That's enough. So off, the preposition, why did this off come in the picture? I don't understand. Be careful when you're speaking, because unnecessary word will result in a negative marking. The next one, idea generation. So your idea, this is slower pace. You're getting pauses and breaks. This is because of your, idea generation ability. That means you're not able to generate your ideas very fast. That's the problem. Okay, you have to generate your ideas a little bit faster. That's number one. Next one is, yeah, frequent pauses. Frequent pauses. In every sentence, 2 or 3 times you're pausing. So you have to control that one and speak fluently. Little slower, no problem. That's not a problem at all. But pauses you have to avoid. That is frequent pauses. The next one, you said, I suggested you to. I suggested you to visit the physiotherapist, or suggested you to. What is this suggested? You are suggesting now. So you say, I suggest you. I suggest you to meet the doctor. I suggest you to discuss with the doctor. I suggest you to meet the physiotherapist. I suggest you to fix an appointment with the counselor. I suggest you to, or I advise you to, I recommend you to. So there is not past tense here. You did not do in the past, you are doing it now. Then how can you say, I suggested you to? It's present tense. If you have suggested 1 or 2 minutes before, then you can say, I have suggested you. It's just within this 5 minutes, you are doing everything, not before. Okay. Even if it is 1 day before, you can say suggested. But here you are doing on the same day. You're suggesting him. I suggest you to. That's what you have to say. The next one. I would like to say you. I would like to say you. This is wrong. I would like to tell you, not say you. I would like to tell you. Okay. Why do you want to say so long introductory phrase? Is it very important? I would like to tell you. I would like to tell you. Okay. Why don't you tell the thing directly? I would like to tell you to be compliant with medication. Just say, be compliant with medication. This is the advice or recommendation or a suggestion or an order or a request or whatever it is. I would like you, I would like to tell you, I would like to tell you that you should be compliant with medication. So why all this prolonged introduction? Just say, be compliant with medication. Follow the rules seriously. Implement the suggestions given by the dietitian. So directly, I would like to tell you, I would like to tell you, I would like to tell you. There is no need of, you are only telling, he is only listening. Then why I and you? Tell directly. It is like a small child coming to the mother and saying, what? Mama, 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 mama. What? I want to tell you something, mama. Okay, what? It's very important. What? No, don't be angry. Tell now what you want to say. See, you are getting it. What nonsense you are doing. Come on, speak something. Tell what it is actually. Why are you beating around the bush? That's what you tell your children. So what are you doing then? Why this I? Why this you? Why this? All these things. Just tell what is to be told. Na? Why this introductory phase? Prologue before every sentence. Tell straightly whatever you want to say. Straight. Hit the nail on the head. Don't beat around the bush. Do not beat around the bush. That's it. Hit the nail on the head. That's it. Straight. No roundabout. The next one is will depends on. Will depends on. Okay, present tense, it depends on. Okay. It depends on. Okay. But will, in future, will anybody add s to the verb? I can place football. I can, or he can place football. He can eats food. She will cooks the food. Will, future, can, may, might. These all relate to future. Will anybody use S to the verb when the modal verbs are already there? No. Only in the present tense we use S. In the simple present tense. Okay. So that's what you have to remember. Will depend on. It will depend on. It will depend on. Your progress will depend on medication compliance, dietary regimen, and exercise program. Your progress, the progress will depend on. That's it. Or the progress depends on. Either use present tense or use future tense. You're messing up. You're using future tense and say will, and you're adding simple present tense S. How come? Right. You can say progress will depend on medication compliance, or progress depends on. Remove will and add S. Hope you understand. The next one. If the pain is reduced, if the pain is reduced, if the pain is reduced, by whom? By whom is it reduced? If the pain, okay, is reduced, by what? By what? Or by whom? Okay, be very careful when you're talking. If the pain reduces itself, if the pain reduces, if the pain minimizes, if the pain lessens, okay, decreases, diminishes, okay. If the pain is less, in case the pain is less, if the pain is minimum, if the pain is maximum, use some quality vocabulary. If the pain is minimum, then no need to worry. If the pain is beyond reason, if the pain is maximum, if the pain is intolerable, if the pain cannot be tolerated, approach the doctor at the earliest. Okay. Next one you said, would you like to? Would you like to? And something. Try. Would you like to try? Would you like to try? After every bit of communication, you're saying something and you're saying, would you like to follow? Would you like to do it? Would you like to implement it? Change the style. Every time, would you like to, would you like to, would you like to, is becoming monotonous, routine, and low quality presentation. Okay. So try to implement something called quality. Try to implement something called quality. Quality is very important. And then you said, lastly, 10th point, a lot of information. A lot of information. Informations. A lot of informations. What is this informations? One information, two informations, three informations, 10 informations, 100 informations. Is there anything like this? You can count how many informations? Is this countable or uncountable noun? Can you say 150 informations? Is there any logic in telling like that? Don't you feel that it is a mistake? Information, a piece of information. I will discuss with you some important pieces of information, some points regarding this information. Okay, uncountable. So don't use S with these things. So that is what for you now. You can unmute and you can say your words. Yeah. Position properly next time, because the camera, is light is facing your back, not your front. Okay, so that we can see you, right? Yeah, come on. You have 60 seconds now. Yes, please. Come on. Yeah, start. Okay, you have to be unmuted, right? I think you muted yourself. Yes, Muthu. Unmute.
Yes,
Yeah,
sir.
yes.
Actually, this session was provided the complete knowledge, and even the minute mistakes have been noted by sir. And definitely, I'll improve myself with sir's correction and suggestions. Really, it was beneficial for me. I benefited a lot from this session, live session. So, thank you very much, sir.
Yeah, right. Next one is Srija Ravindran. The next candidate who participating live session is Srija Ravindran. Whoever is ready, you give your names. Only live sessions, okay? Those who are really ready to participate live sessions, okay? With audio and video. Others, all other students, non-live participation, A live and B written. So those who are, okay, those who are not participating in live sessions, you can just type, okay? This session is a live session where we are typing everything. Our artificial intelligence autopilot, Simon's autopilot is there. My artificial intelligence, it's typing everything. Okay, fine. Hifza, I got your message. You are only with audio. That's fine. Okay, afterwards we'll see. We'll call only on audio. Now this is a live video come audio session. So next, that is another session. Right. So Srija Ravindran. Yes, very good. Srija Ravindran. Yeah. Yes. Unmute your phone. Anybody else? Next round. Anybody else is there? So there are 2 points here. So there are 2 points here. Okay, A live and B written. First live session is over with Muthulakshmi. And the next live session is going to be for Srija Ravindran. Pooja Kesari, I am ready, sir. Is it A live or B written? Write that one. Only I will not open anybody's mic. If you say live, then I am opening your mic and your video. So you have to start your video and you have to be ready. Yeah. So those who have finished also, you can participate and you can listen how others are doing and what feedback I am giving, because we'll learn Yes, Puja Kesari, number 3. Next is your turn, Puja Kesari. So this is only audio come video session. So you can unmute your video. You can start your video. So once you open your video, then I'll set your session. Yeah. Yes. Puja Kesari, you can unmute your video also. Very good. Yeah, that's good. You're ready for that one. Yeah. Now, what you have to do is, first time you are coming for the video session, so you have to turn your phone like this. Auto rotate. Right. Yeah. So, you open your video. Now you can keep it closed. No problem. When you come for the live session, you have to open your video. Right. Now, who is this? Srija Ravindran. Yeah, you can start your video, please. Only you will be live. And I'm opening your audio also. Everyone else can only write. Others be silent. Okay. So, right. So, the second one is, the third one is Puja Kesri. Yeah. Now this is done, Muthulakshmi. And then second one is Srija Ravindran, number 2. So you people will get every day one session like this. Those who are participating like this, you'll get one session. Those who are not participating like this, they'll get only individual audio sessions where I cannot write, where nothing can be typed. Okay, nothing can be recorded, nothing can be done. So your wish, what you want, that I will give. So those who are doing, Muthulakshmi, you can watch this video on the YouTube. You can go to Opter and you can see the typed version of what you have spoken. You can see the typed version of what you spoken. I'll send you the link. You can, you will get the PDF of what you spoke in interlocutor, grandmaster, and nurse Muthulakshmi. Like that one PDF you'll get, and afterwards, okay, we can discuss on that. How many mistakes you are doing and how you are. Okay, these are some general mistakes I again there. Line by line, we'll see. Right. So we are ready with Srija Ravindran.
Yes, sir.
Srija Ravindran, you have already prepared, right?
Okay.
Yeah. So this is the, yes. So right. You want to see the card?
Yes, sir. I want to see the card.
Okay, fine. I'll put you there. Yes. So from tomorrow onwards, I'll give you the card well in advance. Print it and keep it. Or
Okay.
at least if you cannot print, type and keep it. Yes. Right. Here we are. Okay.
Sir,
Yeah,
how may I address you during the role play?
Yeah, you can call me. My name is Abraham Lincoln, and I am 35 years old. Yes, hello and welcome to Seven Sentinels. This is Grand Master Class, and I'm Peter Simon with you. And today we have a nurse, Srija Ravindran from UK or Saudi. I don't remember exactly. Where are you from, Srija?
Kuwait.
Kuwait. Okay, fine. Srija from Kuwait currently. Yes. Yeah, whenever you are ready, you can start.
Good evening, Mr. Lincoln.
Good evening, nurse.
How are you feeling now?
Don't ask me, nurse. I'm confused. I don't understand why you people have kept me in the hospital for so long. There are no signs of broken bones.
Mr. Lincoln.
Jesus, why did you keep me here?
Mr. Lincoln, be relaxed. I can understand your feelings. Lincoln, morning you have suffered a car accident. Due to that accident, you got an injury in your neck. So we have to observe your progress. That is why you are being kept in this observation room. Okay?
That's fine, but why are you giving me medications? Why should I eat all these tablets and all this?
Mr. Lingan, do you have headache?
Yeah, a little bit of.
See, with this whiplash injury, usually patients are getting headache. That is why your doctor has prescribed pain medication. Okay?
Okay.
So you have to follow this medication after discharge also. You, as from our observation, you are okay and you suffered only minor injury. So you will be discharged immediately. How does that sound, Mr. Lingan?
I want to get better in the shortest
Okay.
time possible. I don't want to stay here for long. So I want to know if any physiotherapy or any other treatment regimen will shorten my recovery period.
Mr. Lingan, absolutely, I can understand your feelings. See, you will be discharged with some medication and some consultation from our physiotherapist. Okay? Before your discharge, our physiotherapist will come and teach you some stretching exercise. Are you following me, Mr. Lingan?
Yes, of course, nurse. Go ahead.
So you can practice this stretching exercise at home. That will help to relax your muscle. Okay? That can further aid in your fast recovery.
Okay,
Okay?
nurse.
How does
And
that sound?
yeah, fine. I want to ask you regarding the length of the treatment. How long will it be before I am better?
Mr. Lingan, I am sorry to inform you that I cannot say an exact date when you will recover. Actually, the recovery depends on your compliance to the medication and other advice by your doctor. Okay?
Fine, nurse.
In order to recover fast, you have to follow regular medication and exercise. Then you can recover fast. Okay?
Is there anything else that I need to know, nurse? Because this is very important for me.
I appreciate your concern, Mr. Lingan. You have to follow regular exercise and medication. Moreover, you have to report to the hospital immediately if you will feel any uneasiness like nausea, vomiting, or vision problem. That time you have to seek immediate medical help. Okay?
Okay, nurse, of course. You're absolutely fine. And then what I
Okay.
want to tell you is there a possibility for any after effects or ongoing problems as a result of this accident? Maybe in future, will I have any difficulties?
Mr. Lingan, as I said earlier, you got only a minor injury. Most probably you will not get any further injury in future. Okay? So you have to, I am not getting, sir.
Okay, that's fine. Do you have anything else to tell me, nurse?
At home, you have to follow something like you have to apply heat and cold compress in your neck and shoulder to relieve pain and swelling. Okay?
Fine.
Moreover, you have to use collar to immobilize that joint. These all measures will help you to recover faster.
Okay. I accept your suggestions. I'll implement all of them as far as possible. And thank you for your valuable suggestions, nurse. I
Thank you,
really
Lingan.
appreciate your cooperation and kindness.
Okay, thank you, Lingan. Thank you for listening to me patiently. And I will arrange all the necessary, I will make all the necessary arrangement for your discharge. Okay?
Thank you once again, nurse.
Thank you. Thank you.
Right. Yeah. Next, Puja Kesari, be ready. So now let me give you some suggestions, Srija Ravindran. Right. Yeah. So the first and foremost thing is, why are you taking the name Mr. Lincoln so many times? Is that really necessary? Because I know my name and you know my name and you know that I will not forget my name. And of course, I will never forget my name. So why do you want to remind this name so many times? In just a minute, in a period of 5 minutes, you have used almost 4 or 5 times. What is the need? That's what I'm asking you. You have repeated multiple times, Mr. Lincoln, Mr. Lincoln, Mr. Lincoln. It really sometimes embarrasses a person to listen to his name 4 or 5 times in just 5 minutes duration. Okay. So, right. Next, number 2. You said usually patients are getting. Usually patients are getting. Now you have used a pointer which is related to simple present tense, means always. Usually means always.
Okay.
Always means past, present, future. So when you use such words, you have to use a simple present tense and not a present continuous tense. You have used are getting, patients are getting. Usually I am eating rice. Usually I am going to office. Usually I am playing football. Usually means what? Yesterday,
Always.
today, tomorrow, past, present, and future. This is universal. For these words, you are not supposed to use present continuous. You have to use simple present. Usually, I play football. Play doesn't mean now. I play football means in general, regularly, usually, commonly, frequently, sometimes, never. These are adverbs of frequency, we call them. We call them adverbs of frequency. So for such, okay, you use simple present tense.
Okay.
Usually I play football, but now I am playing football. Now means at the moment. I am playing football. This is present continuous tense, means now it is happening. Then only you will use present continuous tense. You said usually patients are getting headaches. Is this headache going on now? How can you use present continuous tense? You are saying patients are getting headaches. Means now? Are they getting headaches now? At the time when you were talking, were they getting headaches? No. You use present continuous tense when the thing is happening at the moment. Okay.
Okay, sir.
When the thing is happening at the moment, then you will say
Usually
is
patient
getting.
get.
He usually gets. Patients usually get headaches, not are getting headaches. Remember that. So
Okay, sir.
remember the words usually, seldom, rarely, commonly, frequently, never, always. All these words you use simple present tense. The next. Okay. Okay. How many times you will use this word okay? Why don't you say that's right? You are correct. That sounds great. I agree with that. You are right in that regard. Of course, that's true. How many there other presentations are there? Why are you always saying okay, okay, okay for each and every point? Avoid. Avoid a repetition of words or phrases or sentences. Don't repeat the same word a second time. Then you said some stretching exercise. Some stretching exercise. So here, one way it is right, one way it is wrong, but the way how you used, I don't know exactly because it's not clear. Some means I don't know which. Some technique, some exercise. He might have used some technique. Okay, that's it. Then it's okay, singular. Some technique, some exercise. He is doing some exercise. I suppose some exercise means I don't know what exercise he is. Some exercise, one exercise. Definitely he might be doing that one exercise. What I don't know. Then you have to say he might be using some exercise. That is one instance. But here, some stretching exercise, you said. Some stretching exercise. It may be some stretching exercises or a stretching exercise because you know that the point here. You cannot say you don't know because you are a nurse. You should know what stretching exercise it is. Is it one stretching exercise or multiple stretching exercise? You should know. Then you should use either singular or plural. You cannot use uncountable. Okay, or singular. Okay,
Okay, sir.
you can say a stretching exercise, singular, or some stretching exercises, plural. You can use either singular or plural, but this is neither singular nor plural. Be careful. Then in between speaking, you got some confusion and you said, sir, 1 minute, and something you said something, what you talked, only you know, I could not hear properly. There's a confusion and you stopped for maybe 30 seconds. Then next you said, these all measures. These all measures. It's wrong. It's all these measures. All these measures, not these all measures. The word sequence is wrong. So be careful there. Be careful with the sequence, whatever you are telling. Right. All these measures. And that's fine. So this is your first live session. And you can go to your video. This particular video is there on the YouTube. You can go to that and you see how you are speaking. When you watch yourself speaking there, you will know what sort of mistakes you are doing. And you can note down your points, what improvements you can, what are the improvements you can add. You can make note of them. And how is your facial expression? Okay, how is your gesture? How is your position? How your style is? Everything you can watch there. And then you'll get the link for your author. This lecture author link you will get. There you will get all the words which you have spoken typed. You have the video, you have the audio, because you have given the video and you have given the audio. Both you have given. So the video is there and the audio is there. And then you will get the PDF also of this particular speaking. It will come like that. Interlocutor Grandmaster, that's me. And a nurse, Srija Ravindran, yours. Dialogue, A, B, A, B, A, B, what all we spoke, it will be there. And last but not the least, my suggestions which I have given you for almost 4 minutes, they will also be there so that you can take the print and keep it there for you. All your mistakes will be there. So these mistakes should not be repeated. in your future sessions. Now you have 30 seconds to speak whatever you want. Sorry, 60 seconds.
Really, sir, it was a wonderful session. After this session only, I can understand my mistake. Okay.
So how was the session? What did you learn from this session? Speak. You have still 30 seconds. Yeah.
I think I can improve after this session. I will improve, really.
Okay. And listen to the others' audios, videos, whatever they are doing. They are there on our Grandmaster Class YouTube channel. In that you can go through them and you can write down some vocabulary. You can write down some sentences and many other things. And many sentences, many suggestions I have given. Those you can see.
Okay, sir. Okay. Thank
So
you, sir.
here, yeah, next number 3. You can stop your video. Yeah. So, right. Next, Pooja Kesari. Pooja Kesari.
Yes,
You can
sir.
start. You can start your video also.
Okay.
So, third student is Pooja Kesari, who willed for both audio and video. So, she is here with us. Yeah.
Sir, how to turn it?
Yeah, you
It's
have
back
started. You have to turn. Maybe back video you are opening. Maybe front side. You put your face.
Yes.
Yes, that's it. And next one is what you have to do is you have to take your phone like this and auto rotate. Yes, so that you can be clearly seen. Okay, very good. All right. Yeah. So, are you ready with the question paper? Role play
Yes.
card. Okay. Now, I'll keep the role play card for you.
Okay.
Yes. So from tomorrow onwards, you can either print the paper or write the paper and keep ready, because tomorrow onwards, every day one session you will have. Those who want live sessions will have live sessions. Those who want audio sessions will have WhatsApp audio call. Okay. So according to your wish. So you have, yeah, you can go through this card for 30 seconds and be ready. Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Today we have Pooja Kesari from Nepal, and she is preparing herself for nursing profession specific speaking task. Yeah. Pooja, are you ready?
Sir, could you please tell me how may I address you?
You can call me Lincoln because my name is Abraham Lincoln and I am 35 years old.
All right. So, shall I start now?
Yeah, of course.
Okay. Thank you, sir. Hello, good afternoon, Lincoln. My name is Pooja Kesari and I'm one of the registered nurses working in this emergency department. So, how are you feeling right now?
Oh, nurse, I don't know where I am and what I am doing at this hospital. It's, t- I don't feel like I belong to here. Why have I been kept in this hospital for so long? There are no signs of broken bones. I'm fine, fit and fine. And there are no cuts and there are no bruises. What's the reason for keeping me here?
Okay, so I do really appreciate your concern, And you are right in that regard, that why we have kept you here for observation. So let me explain to you the reason behind is that, as you know, you are involved in car accident, and after that you are suffering from a headache and a whiplash. It means that an injury to your cervical spine. So this is the reason why you are kept here. So am I clear so far?
Yeah, of course, nurse. But one more question. That's okay, but why am I given these medications?
You are absolutely right. So, Lincoln, as you know that it is really important to continue the medication in order to achieve soon recovery, and also your doctor has recommended this medication in order to reduce the pain which you have experiencing right now. So, if I understand you correctly, you are experiencing headache. Is that correct?
Yeah, of course.
Okay, so I hope it's clear for you now.
Okay. Now I want to
Mm.
I want to tell you one thing. I don't want to stay here for longer duration. I want to get out of this place as soon as possible. Out of this hospital. And what is the shortest time possible for me to go out? And will the physiotherapy session or any other activity or treatment plan reduce the recovery period?
That is absolutely right, and I appreciate your willingness in order to achieve soon recovery. So, as you mentioned, your concern regarding physiotherapist and to leave the hospital as soon as possible. So, firstly, regarding your physiotherapist, definitely we will provide you a physiotherapist session, the one who will provide you all the information regarding the exercise program and including relaxation exercises which will help to lose your joint. So are you getting my point?
Of course, nurse, I understand the meaning of what you're saying, but I want to know the length of the treatment. How long will it be before I get better?
Okay, so thank you for having this question for me, and thank you for having this question for me. But I'm so sorry to inform you that I'm really not sure how long it will take to recover fully. But I reassure you that if you will follow all the instruction, including treatment and your exercise program, then definitely I can reassure you that you can see the speed of your recovery. So, are you willing to follow all these instructions?
Of course. So let me see. I'll try. And then, is there
Yeah.
anything else in addition to what you have already told? Can you tell me, nurse?
Yes, definitely. I'm here to provide you all the information regarding your recovery, and what you have a need to keep in mind after discharge is that in case if you notice any increase in your pain, discomfort, or if you might feel nauseous, vomiting, or if there is any vision problem, then what you have to do is that you need to seek an immediate medical attention. So, how does this sound for you?
Yeah, that's really very nice, nurse. But okay, one last question. I hope you don't mind. Will there be any after effects or ongoing problems? I mean, in the
Mhm.
future, maybe after 4 or 5 years or 10 years, as a result of this accident.
Okay, so it is really a good question from you. So, Lincoln, based on my experience, and we have treated a lot of patients same as your condition. So, those patients who have followed our instruction, definitely we have not seen we have not seen the side effect and also this type of incident after discharge. And I can reassure you that if you will follow all these instructions, then definitely we can prevent from future complication. So is it clear for you now?
Yeah, of course, nurse. Definitely. That's very clear and obvious. Thank you very much, nurse, for all the suggestions that you have given.
Thank you for your willingness. Thank you for your willingness and your willingness to listen my words. And finally, I would like to provide you one more information. So, would you like to hear about that?
Yeah, definitely, nurse.
Okay, so after discharge, in order to reduce your pain, what you can do is that you can apply heat or ice compression over the affected part, and it's really vital to take all the prescription medication such as analgesic medicine in order to reduce your pain. And finally, I suggest you please use a collar. Here is a collar which will help to adjust your cervical spine. So, will you follow this instruction?
Yeah, definitely, nurse. I will do that.
Okay, I'm really happy to hear from you. And is there anything else that I can do for you?
No, nurse. Thank you very much. I'm really pleased with your support and cooperation.
Thank you for your cooperation, Lincoln. And I wish you a speedy recovery.
Yeah, thanks again.
You are most welcome.
Yes. So, right. So now let us see here. So, Pooja, you have accepted for a audio visual session. Okay, according to the students' demands and requests, I'll give. So you have accepted because of that one. These things are possible. So daily you will have one audio visual session like this, and I'll give you the links. You will get the video link. You will get the author link where you will get your speaking and your audio together. They'll go through, and then you can get the PDF of what you have spoken, and then you can have further because it's already typed. My artificial intelligence has already typed. Because of that, you can get additional suggestions because we can go through line by line, word by word. Whenever I am free, I'll give you weekly one session of complete feedback, like how I give writing sessions. And then now coming to the point, I have noted down some points for you. Are you ready to listen to them? Yes. Unmute. Okay. Pooja Kesari, unmute. Yeah.
Okay.
So you said, I will explain to you. I will explain to you. No need to. I will explain the answer to you. If answer is there in between, then to you is needed. Otherwise, I will explain you is enough. It doesn't mean that this is wrong. This is also right. But there is no need to tell that. I will explain you. I will tell you. No needs to say, I will tell to you. I will inform to you. I will inform you. Direct. No need to use to. When the verb, immediately after the verb, there is a pronoun you. No need to tell. I will explain him. I will explain you. I will explain her. I will explain them. Enough. Directly. After the verb, when you use a pronoun, that is enough. No need to use to there. That's what I say. It is redundant, unnecessary. Next, you have said, oh, oh. One time is enough. You have used 3 times this same, oh. That means it is becoming a habit for you. One time you say, oh, another time you say, aha. Another time you say, okay. Another times, right. Something like that. Don't say the same expression multiple times. That's what it is. The next one is, you said, Mr. Lincoln, And again you said Mr. Lincoln. So 2 times you told all. Okay. 1 time you repeated. No need. 1 time is enough. Okay. Only in the beginning we need. Afterwards we don't know. Just to confirm that he is the right person. When the dialogue starts, no need to say Mr. Lincoln again and again. Not even 1 time needed. Not compulsory. Next one, you said achieve soon recovery. Achieve soon recovery. If you want to achieve soon recovery, no. Achieve recovery sooner or soon. If you want to achieve recovery soon or sooner, not soon recovery. Recovery soon. Okay. Later it will come. Then you said as soon as. And again, after 2 or 3 sentences, again you said as soon as. You repeated this. Avoid repeating the same, phrase or word as far as possible. Avoid them. Then definitely, the word definitely, you have used once. And the pronunciation also definitely, something like that you are pronounced. Definitely, definitely. And you have used first time, then repeated 2 times. That means total 3 times you have used the word definitely. You can go to the YouTube and check it out. I mark here. 3 times you use the word definitely. Why? You can say surely. You can use the word surely. Or you can say undeniably. Okay. Or you can say undoubtedly. Or you can say irrefutably. These are the synonyms of definitely. Irrefutably, no one can say no. That is what is definitely. All right. Undeniably, no one can deny the fact that. Undoubtedly, no one can doubt. This is the way how you can say. The next, you said this is future. If you will follow, we can. Definitely, something you told. If you will follow, we can definitely. So here, in any sentence, there should not be 2 wills or 2 future tense. Only one will be future. If you will follow, you will follow these suggestions. We can help you. If you will do the homework, you will work hard. You will work hard. You will pass. You will work hard. You will pass. Now your style of telling is, if you will work hard, you will pass. Or if you will work hard, you can pass. You said can. So if you will work hard, you can pass. That means you are using 2 models related to 2 future. In one sentence, there should be only one future. One side will, one side can. Wherever if is there, remove that will or can. If you follow, no need will. If you will follow, no need will, remove will. Wherever if is there, remove the will. If you work hard, you can pass. But you're doing a mistake here. If you will work hard, you can pass. Wherever if is there, remove that future concept, will or can, remove it off. If you work hard, you can pass. If you attend the session, if you join the Zoom, I will take a speaking session. If you join the Zoom, I can take a speaking session. You will join the Zoom separately. You will join the Zoom. I will take a speaking session. Separately, both will have. But when you're joining them both into one sentence, only one future will remain. You will join one sentence. Will is there. One future. That is future tense. You can, I can take a speaking session. I can. This is also future. Here will, here can. Both are future possibilities. Now, when you are using if and joining in two sentences into one sentence, one only future will persist. The stronger will remain. And the conditional clause will lose its if clause. It will lose its future. If you work hard, you will pass. That means entire thing is future only now. But one future is enough. No need two future tenses in one sentence. One future. The other one becomes simple present. Because the main tense, main clause, without if, main clause, that is already future. So this also will take that future. If two persons are going one behind the other, if first person reaches, one holding the hand of another, or one holding the shoulder of the other, first one goes, second also will go with him. So that's what it is. This is also future. So that's the point. The next one, you said, one more information. One more information. What is this one more information? That means how many informations did you give? Already you gave 10 informations and another one information you are giving. Do you mean that? You already gave some information. Now you are giving some more information. Some more information, not many, some more information. This is uncountable. You cannot say one information, two informations, three. I gave you 3 informations. I will give you one more information. What does this mean? Information is a collection of points. I'll give you some information. Some, maybe, I'll give you some water, like that. I'll give you some pens. I'll give you some water. This some water type of information here, some information. Okay. It's uncountable. Water is uncountable. Breathe some air inside. Drink some water. Okay. That type of sum here. I bought some pens. This is countable, uncountable. Pens. I bought highlighters. Some highlighters. Like this you can use. This is singular plural. But information you cannot use with S or 1 or 2 with no number here. It's only quantity, some, more, much you can use. Okay, but not many, not few. These are countable adjectives. Don't use countable adjectives for uncount nouns. Then next, so this is the information. Now you have 1 minute or 60 seconds to speak whatever you want. You have 60 seconds to speak whatever you want. How you felt about the session and what you learned from this session. Was this beneficial for you or not? Yeah.
At first, it is really beneficial session for me, and I learn more about grammar, how to use the grammar. Future, with a future sentence, we can use in one sentence with one future. We should not mix it. And you have recorded too many mistakes within 5 minutes, sir. That is really appreciable work, and I appreciate your hard work also. And I'm really thankful for joining this session, and I hope I will attend this session daily, and I will achieve the same type of classes daily. Thank you so
Yeah.
much, sir.
You contact me personally. I'll give you the timing. Okay, every day, same time, you will have 7 minutes or 10 minutes. One time I'll give, one by one, I'll call you that particular time. Okay, so you can join and the speaking session, video session will be there. That time you can join and you can finish your session. Right. Thank you very much. And you can stop your video.
Okay, thank you, sir.
Yeah. So this is how we are going with the sessions. Did anybody Yeah, Rabil. Sir, what is topic? Rabil is a doctor. So I will definitely give you another topic. Now it is time for a dinner. So Simon sir is going for dinner, and we can, right. That's it. Okay, fine. Done. Okay.